We have quite a number of them that have been here up to this point. Please salute to the congregation. Thank you so much, and thank you so much. You can have a seat. Thank you so much for giving us a chance to be here. Thank you.
Thank you, Doc, for being brief. It's a testimony that I taught you well, and I hope you carry on with the mantle. Thank you. We were not able to respond to all the questions, and that's a fact. But I want to give you an email address on which, if you have any query, because we are all over the country, and we work in a multi-sectoral space where we have many partners, both state and non-state, you can reach out to us so that we can respond and even direct you to individuals who can be of help. The email is conference@nsdcc.go.ke. Very simple. conference@nsdcc.go.ke. That email will be open until the next conference, probably in 2 years, but in the meantime, we'll continue fighting the response, fighting on the response against HIV so that we can get 2030 with an HIV-free nation, free of HIV-related deaths, stigma, and new infections. Allow me, ladies and gentlemen, now to introduce the CEO of National Syndemic Disease Control Council, Dr. Ruth Maisha, to come and take over the rest of the program. Daktari, karibu sana. Makofi ya daktari, thank you. Hata mimi nipigie kidogo tu. Thank you. Asante, asante.
Thank you very much. Good afternoon. Our PS, State Department of Public Health and Professional Standards, Madam Mary Mudhoni, our beloved Governor, Honorable Gladys Atieno Nyasuna Wanga, and the Vice Chair of the National Assembly Committee on Health, Honorable Patrick Munene, our Chairperson, NSDCC, Geoffrey Gitu, the Board of Directors. I would also want to take this opportunity to recognize all the CECs present, the Deputy Governors present, and observe all protocols, our partners. And mine is very, very brief. I would like to invite Nelson just to come as we say this. Thank you. Ours is a note of appreciation. You know, you can cook food and invite people and they don't turn up. But when people turn up, you also look at when they are eating the food, how their face look like. What we have seen throughout this conference are happy faces. Tafadhali ambia jirani yako asanti sana. Umefanya nisahau yale yote niliacha nyumbani. We have made friends, and I will take this opportunity on behalf of community to request Nelson to also give a vote of thanks.
Thank you, Dr. Maisha. Allow me to say, Madam PS, all protocol observed. I didn't expect to say a word, but I've been asked to say thank you. But because the people I represent, who are people living with HIV, communities, and civil society are in the room, they also told me to mention 3 things. One, that it is important that we take a commitment, and I've seen it in the recommendations, that from Monday, because you have a weekend to rest, please commit to work with us to end pediatric AIDS. Because during the opening, we said that it is unacceptable with the knowledge we have, with the technology we have, with the tools we have, to still have children being infected with HIV, because science will is us. And they added that, work with women living with HIV through their networks to do that. The second point they told me to say, before I say thank you, is that if you get a person who has HIV today, if they are sick, for those who are sick, who are invited to this conference and didn't come, or if you hear they are dead, what is killing them is TB. And TB we can test. and TB we can treat free of charge. So I think let us commit that we are going to work to reduce the burden of TB among those who have HIV, and to make sure that we have TB preventive therapy, we educate people, and we ensure that people complete treatment so that they are sexually treated, so they adhere to ART. And the fourth area, and we know this government is talking about primary health care and universal health coverage, we said that it costs money. So our appeal is that yes, we work with the Global Fund and PEPFAR, and we appeal for increased direct allocation from the Kenya government for HIV response. And we requested specifically that let the partners take the other components, but where it comes to commodities, where we have ARVs, TB medicines, let that be funded by the government of Kenya. With that, I want to say thank you very much, Madam PS, to the Ministry of Health and to the NSDCC for enabling communities, including adolescent girls and young women who are in this room, men and women living with HIV who are in this room, to attend this conference, and we look forward to further engagement in the future conferences and also during the implementation so that we work together through true partnership. Thank you very much.
Our chief guest, the reason I called Nelson here is because we always have a joke. When Nelson says, Maisha must go, I tell him, Nelson must go and sit where Maisha is seated. So we have a long history. We also awarded Nelson. And the reason I was asking him to start is also to recognize his role. I don't know if you were able to see Professor. Where are you? You can stand up. If she's not in the room, I think she left. But the reason, oh, she's there. Professor is there. The reason we awarded Nelson, our chief guest, you know, there is a lot of political scope in this job. And Nelson probably is one of the most resilient people I've ever met. He has become a beacon of navigating political environment at the same time allowing us to focus on the cause. And that is why we have been very privileged to have you in this conference. He has navigated all of them and reminded us we deal with the politics, but we don't forget about HIV. A lot of applause for you. Professor there, I know the PS hasn't seen you, and you can stand this side so she's able to see you as we finalize. And Professor there is our professor. Many of you do not know the story of Professor. When the story of breast milk came, and breastfeeding discussion about mothers living with HIV, either breastfeeding or powder milk, it was both a commercial as well as a medical issue. She navigated that politics without knowing that she was also dealing with some form of a cartel. And on the other side, she was dealing with the science, but she stood steadfast. And today, we as a country adopted breastfeeding policies that also suit the HIV response. Asante sana, Professor. And before I bring the chair to bring the next guest, I also want to sincerely thank most of the people in this room. I am who I am because of you. My people were asking me yesterday, kwani unajua kila mtu kwa hii conference? And I was telling them, if it's James Kamau, I know him from here. And I met so many of you. I met one lady. I saw her when I was cutting a ribbon to open a VCT center in 2004. And at that time, when I walked in, they had put for me the test kits inside. So I didn't know. Chief of guest, and there was media with me. So when I walked in and there was a camera, you know what that means, yeah? So wakangojea nipime. Mimi nikaambia stigma haijaisha kwetu. So I didn't take the test. So we did a mock test. And she kept talking to me later. did you ever take the test later? I said, yes, but that day I was not ready. So thank you very much. I know you're in the room. Every time I see her, I tell her, nilichukua your test, lakini siyo siku. I also have people here. We have walked around. We have Netpotech. We didn't know about ending pediatric AIDS, but we knew something must be done to the children. Before even elimination of mother-to-child transmission of HIV came to place, we had worked with them. I can mention so many of them, but allow me to mention Patricia as I close and thank her. Patricia, stand up. Our PS, this is the mother of the triple threat campaign. She challenged me in a meeting and she said she was going to show me where the girls were. And I told her I am going to respond to those girls. And I went in the middle of COVID to your county and I met the girls. You know, Patricia does not speak lies. She went to court for access to medicine and now she has come to us with a cry of the child, the girl's child, and again, you've been told the boy's child. Thank you very much, Patricia. And now, wewe ni mama triple threat. I hope my people can see you and we can be able to move forward. So with that, we like to take this opportunity to sincerely thank all of us because we have come up with some of the conference solutions. I assure you, as a technical leader at the Ministry of Health, we are very, very well supported, and the outcome of this conference is not in vain. I sat in a session, Madam PS, yesterday on condoms, and it coincided with a request that Treasury had said to us, can you bring that investment case for condoms we see? So we were able to be given a different dimension of how we can package the case of investment for condoms. For Parliament, we can never thank you enough. You have walked this journey. I think this is the most friendly Parliamentary Health Committee we've ever had. Friendly, dutiful, and really been there for all of us. I want to just take one moment, Your Excellency the Governor, to say that you're aware the Key Population Program has really grown over time. And Waheshimiwa here were able to say people use drugs. But we have female sex workers. But we also have a group of men we have been working with for so long called Men Who Have Sex with Men. Governor, PS, for us, we do not discriminate. As an institution, we are mandated by the government to ensure we provide services to every Kenyan in line with the Constitution. So we are asking for your support, that you help us so that we can be able to navigate the communities when they want to disrupt the program, so that they can understand that we are mandated by the Kenya government to provide services to all Kenyans, may it be in prison, in police custody, or regardless of whatever they are doing. And we are committed as an institution to ensure that happens. Thank you very much. I take this opportunity to invite my chair and also thank the directors of the board who are behind the work that you have done. To the staff of NSDCC, thank you so much. I'm reminded that this conversation cannot have happened. In Dorothy's book, those who read, you'll see the desperation of people drinking urine. Muliona hiyo? Concussion. In this room, we cannot forget to send our deep gratitude to the people of American government. We want to tell the American people, asante sana. PEFA. We also cannot forget to thank the Global Fund. Again, we want to say asanteni sana. To my friend Raymond. Raymond, we call him Kenyan from Zimbabwe. In the global scene, we know how to speak with eyes. You know your friend when you can speak with your eyes, yeah? Munaangaliana tu na munajua hii tuende ama barabara hii tuende. Raymond and the team from Eswatini, please take our greetings to the kingdom of Eswatini. Those came to your session now have known about Eswatini. Is a king, yeah? The chiefdom. Please pass our greetings. And Raymond, to the new government of Zimbabwe, We wish you the very, very best, and we will continue coming to learn from you. Asante sana, Chair, karibu sana.
Thank you very much, Madam Ruth Maisha, our CEO. I want to start by thanking you all. And I want to say, Madam PS, State Department of Public Health and Professional Standards, Honorable Mary Muthoni, Governor of Homa Bay, Honorable Gladys Wanga, Vice Chair of the National Assembly Committee of Health, Honorable Patrick Monene, members of the National Assembly, county officials present, our partners, distinguished guests, ladies and gentlemen, all protocols observed, good afternoon. Today, I'm happy and excited about the success that we have witnessed over the last 3 days. It's been quite a wonderful time to interact with you, and we have witnessed the power of collaboration, innovation, and education as we worked to explore both opportunities and challenges that must be managed to end epidemics. We have shared insights, forged partnerships, explored opportunities to leverage as we strive to end AIDS by 2030. True progress in the fight against epidemics demands visionary leadership at every level of society. And I thank our CECs and members of the county assemblies who have been here, joined us as we progress in collaborations with them. We all belong to one mother. It requires leaders to prioritize public health, embrace evidence-based decision-making, and yielding in their commitment of the welfare of their people. It requires leaders who understand that health of a nation is foundation upon which prosperity and stability is built. The young man who was here has just said, the young lady, sorry, Stephanie, just said that we all need support of each other. Distinguished ladies and gentlemen, our responsibility as scientists, policymakers, and healthcare providers is to put the needs of our communities at the center of our efforts. This should be the driving force behind our work as we strive to ensure that no one is left behind in our pursuit of a healthy society. Fathers, ladies and gentlemen, we must invest in research and innovation and harness the power of technology to stay ahead of emerging threats. Distinguished ladies and gentlemen, let us return to our homes and institutions with renewed strength, armed with the knowledge and insight gained here. Let us continue to be leaders who advocate for health and champions of the people who need us the most. Let us seek out new partnerships and strengthen the existing ones, knowing that it's only through collective action that we can achieve the lasting success. As I conclude, I want to express my deepest gratitude to all of you who have made this conference a resounding success. Our journey in ending epidemics is long and challenging one. And I want to salute our heroes and the people who have championed HIV. And I recognize all of them who have, in this journey, who have passed on, because it's a journey worth taking together. Together we can and we'll make a difference. Thank you, and may our shared commitments and leadership, people, science, partnership, guide us towards a healthy and more secure future. As I conclude, I call my CEO, and I also want to tell her that I think stigma still in your place is still there, because there is a room that we visited that had 2 seats, and I expected us to stop there and get tested, and none of us did that. But as I conclude, thank you very much. Asanteni sana.
Thank you very much, Chair. Yes, indeed, we were reminded yesterday that we are forgetting the older men, and the young people told us, PS, we take condom demonstration to the older generation because they are even scared of seeing the condom. And I want to confess, I saw it when we were being demonstrated, the condom. So the female one, we had not seen, most of us had not seen it, and so we have taken the young people recommendation. I hope it to be added on those recommendations that training of condom use goes to the older generation. At this juncture, allow me to invite Maxwell. You said you wanted to say something? Okay. Sabani one? Okay, say it. You know, lazima, Madam PS, hawa ndio watu wa pesa.
All protocol observed. I just want to say at Santeni, first of all, to thank the communities. As Dr. Maisha has said, we would not be here without the communities. My message is very simple, Madam PS and my good friend, Dr. Maisha, and of course, our good friend from the Governor of Homa Bay and Vice Chair of the Committee on Health. And now, Munene, you and I are very good friends. We as PEPFAR have been here for 20 years. And I just
have taken that and will take it everywhere. The communities have appreciated. So thank you very much, and back on the program, allow me to take this opportunity to invite the Vice Chair of the National Assembly Committee on Health, Honorable Patrick Munene, and thereafter he will be able to invite Her Excellency, Honorable Gladys Wanga, who will bring for us our chief guest. From my side, asanteni sana na Mungu awabariki.
Thank you, Asante Daktari, Maisha, the CEO, Sedemic, our PS, Madam Modoni, Morioki, the Governor, Gladys Wanga, the Chair, Sedemic, the representative from PEPFAR, the donors present here, all protocols observed. Bwana Yesu asifiwe. Muko salama? You know, the energy I left here on Monday, nakuja nakuta is the same energy. Ni kama hii workshop ingeendelea kidogo mpaka Saturday. Naona watu bado wanataka kuendelea na hii workshop yako, Maisha. Madam PS, I was here with PS early when we officially opened this conference. And before then, the Committee for Health in the National Assembly had been taken to a tour by these people of Mombasa County and the drug users and the rehabilitation program that they have put in place. And I want to tell you, Madam, it's a fantastic program. But before you understand it, you'll have so many questions about it until you understand it. Governor, when I came to this conference on Monday and introductions were done, and I saw we had Governor Wesley, we had a number of deputy governors, and the CECs were introduced, and the directors in the counties, and the chief officers. I was so happy. Because since devolution, we have had a problem with the county government where most programs remained at national and it didn't trickle down to county government. And until you have a program that can trickle down to the county government, then you are not achieving anything. So I was so happy, Governor, when I found what Maisha was doing and the chair and how they were working well with the county governments. And I want to congratulate my brother, the chairman now of the CECs. This is a dream that was born that night when we sat with him. And we said this guy can make a very good chairman because I found him very conversant with all the issues and very eloquent about all the issues. So Chairman, I want to congratulate you because the CECs are the 47 counties form a serious anchor to everything we do in the health sector. So I want to congratulate you, Chairman, and wish you well in your leadership. My CEC is also here from Tharaka Nithi, and Dr. Nduraku, that is my CEC. He's a man doing very good work in Tharaka Nithi. Coincidentally, my governor also happens to be the chair of all the Council of Governors, then I'm the vice chair of the national government. So Tharaka Nithi ni mali ya health. PS, when I came here, I was telling these people my first job, when I left university, I was employed by National Inns Control Council, by Professor Alois Olago, and he made me a coordinator. The governor nilikuwa naambia watu, that time kulikuwa na a lot of stigma. So wakati nilianza kufanya mambo ya HIV kwa village, watu walisema huyu pia ametoka na ukimwi huko university. Ndio maana amepewa hiyo kazi. So even getting a girlfriend became very difficult. So I was telling them, I was showing them the woman who helped me then. Nikapata mama moja, akaniambia hii kitu watu wanakutisha sijui HIV positive. What if you are positive? Who cares? I'm positive. Na tukaanza kutembea na yeye akifunza watu, later tukafanya a very good campaign. Ile organization ilianza hiyo wakati ya watoto wale wamezaliwa positive, hata saizi inaendelea na imekuwa kubwa. So wakati nilichaguliwa mbunge, nikachukua huyo mama, akakuwa ndiye ananisaidia mambo ya HIV in my office, and she is seated there. She's called Kanini. Huyo ndiye ananisaidianga na kazi, and she's a powerful woman. Fanya kazi nyingi. She has demystified HIV in our place. Niseme, Madam Maisha, you're doing a good job. You are learning this thing in a good way. Sisi kama bunge, we can only support you and wish you well. Madam PS, sisi kazi yetu ni kukusupport in this work, and I tell you, your people are doing a very good job. Finally, before I say what is here, najua tulisema hii Kenya ni kama tuko karibu kukubaliana nchi mzima kwamba mambo ni matatu. Na nimeona kama hii conference pia mmekubali mambo ni tatu. Nimeona mmesema kama hii mambo ya cervical cancer mambo ni tatu, ni vaccination, early detection na proper management. Hii ingine pia madam pale ametukubali mambo ni tatu, ni teen pregnancy, ni GBV na HIV AIDS infection. So mambo ni tatu. Hata conference mkianza mlisema ni leadership, people, science and partnership. Mambo ni tatu. Pia hii maneno ya ukimwi mambo ni ukae bila kufanya hii maneno, ama ustiki na muti yako moja, ama utumie condom. Mambo ni tatu. Ni kama tuko karibu kukubaliana njia ya kwenda kwa hii nchi. So sina mengi ya kusema leo. Madam Pierce, I want to say I'm happy to stand before you again today as we conclude this extremely significant conference in HIV response. When I stood at this podium on the first day, I've truly enjoyed and benefited from the rich and thought-provoking interactions out there. I believe that this has been your experience as well. These 3 days of leveling and enthralling conversations and presentations have given me hope that our country is on the right track towards ending HIV AIDS by 2030, if all our eyes remain firmly on the ball over the next 7 years. The work presented at this conference was not only relevant to the conference theme of ending epidemic, leadership, people science, and partnership, but was also anticipatory for stalling the needs and solutions necessary to achieve both local and global targets for HIV response. I must thank our scientists and development partners whose knowledge and resource have driven the war against HIV AIDS to the brink of victory. Nataka kusema once more, as a country, tunashukuru sana our sponsors. Our donors, we want to really thank you. We'll continue working with you. Na kama vile niliomba ile siku, msitoke haraka sana mkisema we are a developing country, endeleeni kusaidia sisi, na we'll continue utilizing your money well. Wakati tulikuwa pale nje tulikuwa tunafunzwa leo how to use a female condom. I've never gone through that class. Leo ndio nimeenda. Ile wakati nilikuwa kaka zikuwa zimekuja na ile mtu governor ametuambia maneno ngumu sana. Hiyo mtu amesema ati mama ataweka hiyo kitu angoje 15 minutes. Sasa wakati nimeangalia hiyo curriculum ya hiyo mtu nikaona iko na shida kwa sababu hiyo Mr. Condom na curriculum yake iko na shida. Nikamwambia ende hiyo curriculum improve, aweke maneno ile watu watakuwa nafanya hii 15 minutes wakingoja. Sasa wakingoja ndio hiyo curriculum yake ikae mzuri. Sasa ndio tumekuwa kwa sababu sasa huwezi sema ati aweke alafu akaoshe vyombo. So tumekubaliana hiyo curriculum yake atengeneze ndio ikae presentable, kwa sababu sasa vile iko saa hizi anaipresent in a bad way, in bits. Lazima aweke curriculum mzuri. The HIV response in Kenya has registered great success, but we admit that there are still challenges. We must work together to fill the resource gaps that exist to ensure sustainability and secure the gains made. The National Assembly is committed to providing the necessary legislative and oversight support to ensure the fight against HIV and AIDS remains on the right trajectory. Do not shy away from seeking our support on this journey. Distinguished ladies and gentlemen, on behalf of my colleagues, when I was here, I was with my colleagues. Na si ati wameenda. PS had organized another meeting with the Parliamentary Committee on Health, which has started today this morning. Ndio maana tumechelewa kidogo na PS tumetoka kufungua hiyo mkutano. So the members of parliament are there, and those sagas from the Department of Public Health. Na hata tukitoka hapo tunaenda kuendelea na hiyo mkutano. So all my colleagues give their assurance that we continue supporting this journey. Mahali munataka tuwasaidie. I thank the organizers of this conference for inviting us to be part of this team of incredible professionals and scientists. Mimi sina mengi ya kusema leo. Ile kitu nitasema ni Bwana Rukalia from the ministry. Some of these activities, until you come and be part of them and see what is being done, utakaa kwa bunge ukipelekewa makaratasi unasema hii pesa yote imekuliwa. Lakini when you go out na uone ile kazi imefanyika na the impact of what is happening, hata Maisha akikuja kwa kamati sasa kuleta budget na kupresent, at least I will know what she does and I've seen what is being done. Kwa sababu nimeona ni kazi nyingi. Vile beleni nilikuwa na wakuisho ni pesa yote mnapeleka wapi, nimekuja kurealize kumbe hata hakuna pesa tumeweka. Ndio tunatakikana kuprovide pesa sasa. So we'll continue supporting you. We take 2 challenges from here. One, from Nelson, that as a government, we need now to start putting more budget for the drugs. That's a challenge. Nelson, I will talk to the committee. We have started the budget process. So that's a challenge. 2, we've been challenged as Parliament to start a caucus on pediatrics. We've been challenged. It started here with the senator. Imekuja tena leo. Na kumbe that a challenge I take very positively. issues to do with children and health are very close to my heart. So you can even go assured that that will happen. Last year, I lost my daughter to cancer, 10 years old, in November last year. So matters children and health are very close to my heart. So the caucus on pediatrics is a challenge we take, and I take very positively. Mimi nataka kumalizia hapo nikishukuru Governor Wanga. Wanga nilikukuta bunge, and I know you are a powerful voice. So I know with you here, at the Council of Governors, you people have a very powerful voice with the name of Governor Gladys Wanga. I know in parliament wakati unasema kitu itafanyika hivi, ulikuwa unapigana mpaka inaenda hiyo njia, na hata kama itafanyika tutajua stand ya Wanga ilikuwa gani. Najua hivyo ndio inaambiangwa. So I know at the Council of Governors with you, we have a serious advocate. Na tunakushukuru for even finding your time away from your busy schedule. We know being a governor is a busy schedule, and being here with us. Na governors, tunawaomba mtusaidie na watu yenu CCs wakuwe wanasaidia hii kazi, kwa sababu wakati wanakuja na tunafanya na wao, hata budget zingine watakuwa hata wanatusaidia kutuambia ongezeni pesa counties. So wacha watusaidiange kazi kidogo. Finally, Maisha, we'll continue supporting you, kwa sababu what is killing most of our institutions is leadership piecemeal. Mtu anakuja kazi leo, akijua kazi wiki mbili tunatoa tunaweka mwingine. Akijua kazi tunatoa tunaweka mwingine. Hata donors wanaanza kurusi confidence na what is happening. So we need to ensure some sustainability in some of these programs. Na hiyo mengi nataka tukaribishe kwa shangwe governor wetu, Governor Gladys Wanga. Karibu sana governor.
Thank you, Asante Pato. Thank you very, very much. Our PS for Public Health and Professional Standards, Madam Mary Mudhoni, our National Assembly Vice Chairman of the Health Committee, Patrick Munene, Dr. Maisha Achola, which is the name we have given you from Homa Bay, together with the board chairman for the National Syndemic Diseases Control Council, our partners, our CCs in the room, led by your chairman, and congratulations, chairman. Kumbe yo mpango mlipanga na Pato. Congratulations, chairman, for your election. Our communities, people living with HIV who are here, our communities from various places. Good afternoon. Let me recognize my CC for Homa Bay, Roslyn Omolo, CC Health Homa Bay. I can see our County Director for Health, Dr. Komo. Anybody else from Homa Bay ambaye yuko hapa, please wave in the air. I can see there are many Homa Bay residents here. Kura ni mingi hapa. I bring you also greetings from our chair of the Health Committee for the Council of Governors. That is the Governor for Tharaka Nithi, Governor Muthoni Njuki. He sends his greetings, and really to say that I think the work that has been done here the last couple of days has been great work. Our teams have been here. We've been properly briefed, and just like Honorable Patrick was saying here, I've also been in the HIV prevention world before I left to be in Parliament. I worked with LVCT Health. I don't know whether LVCT are here. You know, you always have a free billboard, a free advertisement from me, because before I left to become woman rep for Homa Bay, I worked with LVCT for several years as HIV prevention, community coordinator, mobile VCT, even pato ile mambo ya condom demonstration, sisi ndio tulianza na Ngara. Huyo king of condoms, he used to be my staff. Sisi ndio tukapanga hiyo maneno yote. Sasa hiyo 15 minutes mimi ndio nitafanya hiyo curriculum ya kupanga hiyo kazi within that period. So it's not a strange space. It's a familiar space. We are family, we've been here. So Dr. Maisha, even as you continue this work and that you have continued to do outstandingly, you can be sure that you have our support, not as strangers, but as people who've been part of this journey, who have walked through this process, who've seen how this has developed. So you really do have our full support. So I come here today as governor for Homa Bay, the county of endless potential, but also as vice chair of the health committee of the council of governors. And, so that together we can discuss this pressing issue of ending AIDS in Kenya by the year 2030. And the challenge we face is complex, yet we must persevere in our efforts to ensure a healthy and prosperous future for our country. So first and foremost, we must acknowledge the progress we have made so far. Kenya has been at the forefront of the fight against HIV/AIDS, and our efforts have achieved remarkable success. And moving forward, we must continue to adopt a multifaceted approach where governments, and here I must say governments, both national and county governments, working together, hand in hand. Health is a devolved function, and we are very protective about health as a devolved function. As governors, CC, we are very protective because we don't want to claw back on the gains that we have made as far as devolution of health is concerned. So when we raise our voices sometimes, it's because we want everybody to continue to acknowledge health as the devolved function that it is. But the Constitution is very clear about how the national and the county governments function, which is in independent but interdependent manners. And one of the areas that we must collaborate in and work hand in hand in this fight to end HIV. And that is why we are saying that we are ready, to walk this journey together. And we've already, had discussions with our CCs, ourselves, and we have said, whatever it is that is between the counties and syndemic, or whatever it is that we are saying, let us not resolve it in any other manner. Tukae chini, tuongee, because we are all working for the people. Our whole purpose is to serve the people of this country in our various counties. So whatever it is, wacha tukae pamoja, tuzungumze, we agree, and we move forward in service for the people of Kenya. So governments, our CSOs, our development partners, the private sector, our communities, making sure that we never leave behind the voices of our communities. This is about the people, for the people, by the people. And in Homa Bay, we say we are people-centered, and I'm sure in all our counties, it is about the people. And if it is not about the people, then we don't want to be part of it. And that is why I am very, very happy, Maisha, that you're carrying the communities along. You're getting their voices heard. Since we sat here, you didn't just come here and you want us to just hear your voice, and you tell us ABCD. We have heard from Dorothy, launching her book, and she's been given this platform and this space, and congratulations, and you're my constituent. So we are very proud of you, and thank you for giving her that platform to make that launch and having the voices of the people heard. In Homa Bay, we are perhaps, one of the counties that have higher burden, but we're also one of the counties that has made some of the greatest strides in this fight against HIV. We have pushed to change the face and to change the narrative. So I'd like to also just introduce to you Homa Bay's Triple Threat Initiative. And we have come together and with your support, Maisha and LVCT Health and EGPAF, we have come together as women leaders, because Homa Bay is another county again that we have elected many women leaders. We have, out of 8 constituencies, 3 women elected as MPs. We have many women MCAs. We have a woman governor. And we said this effort must start from somewhere. So we have built a caucus, a strong caucus, in an effort to end the triple threat. And it's a reality in Homa Bay, and you're welcome to come to Homa Bay. I think it is on 8th of next month when we will be launching the Kenya plan to end AIDS in children. By 2027, launching the RRI. When you walk into any facility in Homa Bay, and I go to many facilities all the time, there is no day. I don't know whether you see it anywhere else, but every facility I walk into, there is no day that I don't find a child delivering in our facilities. So you will always find a 16-year-old, or a 13-year-old, or a 15-year-old. So when you talk about teenage pregnancies, for us it's not just a number. It is a serious issue that we must deal with. So our initiative aims at reducing the 3 threats. Na mambo ni matatu, lakini mimi ile ya kwenda binguni ndio sikubaliani nayo. Sijui watatu watafuata njia gani pato wakienda binguni. Hiyo siko. Ile watu kwenda jela sawa. Watu kutoroka Kenya sawa. Lakini waende binguni. So the triple threat. So we have a goal to reduce the triple threats by 75% by the year 2027. And we are going to do this through mobilizing our political leaders, implementing catalytic interventions, utilizing a multi-sectoral approach, investing in research, monitoring, and evaluation for learning and accountability, and resource mobilization. So we intend to put this caucus and reach out to every other stakeholder. And our chair, Ombati, spoke about the boy child. We also intend to bring the men into the room, and walk this journey of ending the triple threat together. So as Vice Chair of the Health Committee in the Council of Governors, I've accepted the role of champion of triple threat elimination. And in this capacity, I will galvanize the support of my fellow leaders in achieving the end of AIDS by 2030. We have the knowledge, resources, determination to achieve this goal. Now we commit to leadership, which has been there, but is also required at all times to complete this equation. Let us work hand in hand, united in our efforts to create a future where HIV/AIDS is no longer a threat to our nation. And on behalf of the Council of Governors and all governors, we give our commitment to walk this journey together with all of us. Asanteni sana, and let me now take this opportunity to welcome our PS for Public Health and Professional Standards, Madam Mary Modhoni, with whom we have now been meeting at many fora, and it appears, makofi tafadhali, PS akikuja, to speak to us. Asanteni sana. Welcome, PS. Asante. I think that's you.
Before I say anything, maybe we can please stand up, take a moment of silence for the more than 2 million lives lost to HIV-related illnesses in Kenya. Please take your seats. Her Excellency, Madam Governor Gladys Wanga, the Deputy Chair, Parliamentary Committee on Health of the National Assembly, Honorable Patrick Munene, the Chairperson, National Syndemic Diseases Control Council, Mr. Geoffrey Gitu, and other board members, the CEO, National Syndemic Diseases Control Council, Dr. Ruth Maisha, and all other officials from the Ministry of Health, county executive members of health led by Daktari Ombati Timothy, and other county officials present, our partners, PEPFAR, MAX, and other different communities, distinguished guests, good afternoon. Good afternoon. You know, when you're told to speak after politicians, you barely have words. Utaanza kusema mambo ni matatu, alafu unasahau yote. Sasa mimi sijui nitaanzia wapi ukiongea after Pato, and then Madam Gladys. But all said and done, I think yetu pia ni tatu kwa ministry, na ni ile mzuri: protect, promote and prevent. Hiyo tu. Now, Honorable Pato, if that is a campaign, we will start it here by protecting ourselves, by hiyo kitu, promoting, educate, 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 and prevent. If you have to abstain, then let's do it. It is with great pleasure that I join you today to draw the curtains on this enriching Maisha conference. I promise you, I will not miss another. I will keep coming. Because those practicals that I have seen out there, I will need to see them. And just like somebody said, that we kept being told, you need to be taught about sex education. But who teaches you? During our time, you simply were told, don't get pregnant and don't get diseases. But how to? Nobody told you. Nobody taught you. So I am informed that for the past 2 days, we have had nothing short of inspiring, thought-provoking, and truly insightful. And on behalf of the Ministry of Health, I extend our heartfelt gratitude to each one of you and every one of you for contributing to the success of this conference. I take this opportunity particularly to equally thank our international distinguished speakers from Zimbabwe, the Ministry of Health, Nigeria, for generously sharing your expertise, experiences, and fresh insights. Your contributions have been invaluable in stimulating conversations that will undoubtedly continue long after the doors of this conference hall close. Ladies and gentlemen, the HIV response in Kenya is a great example of how multiple sectors working together can be effective. The core principles of a single coordinating authority, a harmonized country strategy, and a comprehensive national monitoring and evaluation framework have synergistically fostered unwavering dedication and collaborative accountability. This response is truly impressive and shows how other important health issues can also be tackled successfully. During this conference, you have demonstrated the positive trajectory in our efforts to address the HIV epidemic, notably the reduction of new HIV infections by 78% in the last 10 years, and many lives saved due to expanded access to antiretroviral treatment. Clap for yourselves. While celebrating these achievements, it is important our true joy lies in witnessing people in living with HIV live long and healthy lives. We acknowledge the collective efforts that have brought us here. The government is committed to attaining universal health coverage, and truly speaking, there have been activities that we have seen in the recent past to simply just ensure we are covering everybody in all corners. And to attain UHC, we have seen an expanded healthcare infrastructure. And Her Excellency here can attest that we are very keen to know who has what, which healthcare has which type of infrastructure, and also providing the health insurance that is affordable to all. Just the other day, you have seen the cabinet has approved the social health bill, which is going to be taken to Parliament. And this is an equalizer to just ensure that everybody has access to healthcare in this country. And of course, promoting preventive care to reduce the cost of quality of care. Just the other day, we have just concluded a very rigorous exercise on assessing the healthcare facilities. We want to know the gaps that are there across the country. For instance, we want to know how many dispensaries are even in your local place. Do they have doctors? Do you have the specialized care that is required to be there? And because His Excellency is going to be launching the 100,000 community health promoters that work in tandem, hand in hand with the county government, it will be very easy that these community health promoters know exactly where to direct people. The referral system should be working in this country. That wherever my mother is, if she has a flu, and probably it is something that the community health worker may not manage, then they are able to direct her, go to the nearest level 2 hospital. So we do not want to have health facilities that are rated to be level 4, but the quality of care is that of level 1. Therefore, we have assessed all the health facilities in the country, and we will be giving the report very soon to know exactly how many facilities are there, what are the gaps in human resources, what are the gaps in infrastructure, and equally, what is it that is required for them to move to the next level. And of course, we are very keen on digitization. We do not want the way that things have been happening before. When you come from one health facility and you move to another, you have to start your story from A and you're going to Z. Therefore, we would want the facilities interlinked in such a way that if you are from one area and probably you are late, you're in Mombasa today, and your records are in Nairobi, the doctor in Mombasa can be able to read the history of your disease, and you can be able to be taken care of the best way possible. So ladies and gentlemen, the concerns voiced in this conference regarding the HIV status among adolescents, na hata hiyo nimesikia, maneno ni matatu. And they have said very keenly that there are things, one, end AIDS among children, reduce the burden of TB among people living with HIV, and increase domestic financing. Those are the 3 things that I had. Therefore, the concerns that are voiced today in this conference regarding the HIV status among adolescents and young people will continue to be our foremost concern going forward. The variety of viewpoints shared would expand our horizons, inspiring us to explore, innovate, and uncover new approaches to tackle the challenges. I applaud the collaborative efforts of the National Syndemic Diseases Control Council, the National Council for Population and Development, and the Ministry of Interior and Government Coordination. They have united various sectors to combat the intertwined issues of new HIV infections, adolescent pregnancies, and gender-based violence. We must demonstrate how our domestically crafted solutions stand ready to address complex challenges through comprehensive interventions. As we bid farewell to this gathering, I urge each one of you to take the inspiration gained from the interactions and translate into actions. I always say it is time that we moved the many decisions that we discuss in these meetings into actions. Take the decisions that have been made on the table into action. Thank you once again for your active participation. I look forward to the positive impact that will undoubtedly emerge from the seeds we've planted here. I take this opportunity to wish everyone a safe travel, and I declare this conference closed. Thank you.
I invite you, ladies and gentlemen, because after the chief guest has spoken, we don't speak no more. But I just invite you to remember the good old times of the Nyayo collapse, so that we can give a befitting appreciation for joining us together with the other dignitaries, and also for our brother PS Ari Kimutai who had joined us earlier. Moja, Mbili, Funga, Fungua. I can see some smiles of the people who were there at that time. It tells me your age. Thank you very much. And now I kindly request that we may all be upstanding for the national anthem. East African anthem, first answer. Thank you very much. Sheikh Yusuf Nasur Abu Hamza, kindly come and lead us in the closing prayer.
Tuombe. Bismillahirrahmanirrahim. Kwa jina la Mwenyezi Mungu mwingi wa rehema na mwenye rehema. Mwenyezi Mungu, tunakushukuru kwa siku zote ambazo tumekuwa hapa. Tumekushukuru kwa subra ulotujalia. Tumekushukuru vile vile kwa yote ambayo tumezungumza. Tunakuomba Mwenyezi Mungu, yale ambayo tumesoma kwa siku zote ambayo tumekuwa hapa, utujalie yawe ni yale ambayo yatatusaidia katika kufanikisha, kupunguza, kupambana na kuwasaidia wenzetu walioathirika. Tunakuomba Mwenyezi Mungu kuwa katika yale yote tumetimiza kama malengo katika siku hizi 3, tunaomba yawe ni yale ambayo yatatusaidia katika kujenga kielelezo cha siku zijazo. Na katika yote ambayo hatukuyatimiza, Mwenyezi Mungu tunakuomba utujalie kwamba tuweze kuyatimiza kwa siku ambazo zitakuja. Tunakuomba Mwenyezi Mungu kwamba utukutanishe baada ya miaka 2 tukiwa salama, tukiwa sote na afya, tukiwa na furaha kama tulivyokuwa hapa. Tunakuomba Mwenyezi Mungu ya kwamba ikiwa kuna mapungufu ambayo yametokea katika wote ambao wamesaidia kutuleta hapa, katika mapungufu ya kibinadamu, tunakuomba Mwenyezi Mungu uwasamehe na uturekebishe wakati ambapo sisi tutakuwa tumekosea. Mwenyezi Mungu, kwa yale ambayo vile vile tumefaulu, tunakuomba jitihada zote hizo uweze kuzilipa kwa wema. Na viongozi wetu wote ambao wameungana na sisi Mwenyezi Mungu kutoka sehemu mbalimbali, kutoka kaunti mbalimbali za nchi hii, Mwenyezi Mungu uwajalie busara, uwajalie hikma na uwape nuru na uwape mwongozo ili wawe ni viongozi na kielelezo chema kwa jamii zetu. Tunakuomba Mwenyezi Mungu ya kwamba katika yote ambayo tumeyafanya, katika yote ambayo tumeyazungumza na katika yote ambayo tumeyatekeleza, yawe yatawanufaisha ndugu zetu wengi walio nje ambao wameathirika, ambao wanatutegemea sisi katika mafanikio ya yale ambayo tumeyafanya. Mwenyezi Mungu, usijalie kwamba siku hizi tulizokuwa hapa ziwe bure, bali ujalie kwamba ziwe ni siku ambayo itasaidia kuleta mafanikio si kwetu tu bali kwa nchi nzima. Wote ambao wanasafiri Mwenyezi Mungu kutoka makwao sehemu mbalimbali, uwapeleke salama, warudishe makwao salama. Wote ambao wametatizika kiafya, wametatizika kwa njia moja nyingine, waondolee matatizo. Kila ambalo limekuwa gumu hapa wakati tumekuwa, Mwenyezi Mungu utatufanyia rahisi katika siku zijazo. Kila ambalo halikuwezekana utaliwezesha katika siku nyingine. Kwa kila ambacho kimekuwa mbali utakileta karibu. Mwenyezi Mungu tunakuomba kwa sababu hakuna mwingine wa kuomba ila wewe, ndiye muumba, ndiye mweza na ndiye mjaliwa wa kila kitu. Wa sallallahu ala sayyidina Muhammadin nabiyil ummi wa ala alihi wa sahbihi wasallam. Amin.
Thank you very much, ladies and gentlemen. Lunch is served. Bon appetit. See you.
Thank you. I will request the protocol team kindly to exit our VIPs. Let's allow them to be the first, kindly. Protocol team, haraka haraka tafadhali, mheshimiwa wanapotoka.